Ma'am might have taken, okay, maybe 9th hoga. Yeah, good afternoon. So today we will start up with last log, and we will get on to the other one.
Sir, a little limelight on cognitive impairment disorders also after the last block.
Unit 8 hoga, right?
Unit 8.
Right, no problem. Okay, 10 hoga. But I don't know, each topic takes one complete session. They have included so much, and they have restricted it to 8 classes. And before it was only 6 classes. Now they've increased 2 classes. So we are also helpless, and if we tell to them also, they say only one thing. Already material has been given, so it's only telling them the important points or the summary. So we are also helpless. Okay, so let's start with unit 10, the block 3. So this particular block 3, it talks about disintegrative and substance induced disorders. Okay, so unit 10, disintegrated disorders. Unit 11, mental retardation. 12, it is talking about substance induced disorders. So we will start with 10, that is disintegrative disorders. Okay, in this they have given first one, ADHD. Okay, ADHD, it's little bit common in the sense. So most of them, they have awareness about this particular disorder, which is called as ADHD. So ADHD stands for?
Is it
A, attention.
Attention deficit.
Good. Attention deficit hyperactivity disorder. So that's what I said. No, first you should get one. When I said attention, then immediately you could tell the other one, because general people also have very much awareness about this particular ADHD.
So is this also called as Asperger's syndrome?
That is different.
Okay.
That would be because of infection.
Asperger's syndrome?
Yeah.
Okay, sir. Thank you.
Yeah. So ADHD is one of the common childhood disorders. Okay. Continue through adolescence and adulthood. So the main characteristic is attention deficit. Why a person is having attention deficit? Because he is hyperactive. Active. Good. So the person being hyperactive. So already we discussed about what is hyper. Hyper is
energy, more energy.
Higher. Okay. If you're saying in terms of more energy, positive.
Yes.
Done. Okay. Hyper is more. Hypo is less. Yeah. So this is with regard to activity. Hyperactive. The person is more than required, is very active. So what happens if a person is very active?
The person becomes very restless and agitated for little things.
Good. Main thing, restless.
Yeah.
Here are the top search results.
Yeah. So net was down. Is it okay now?
Yes, sir.
Yeah, okay. So even maybe long back when we were taking for UG, maybe that was the first batch. So like this, it got disconnected for once. Maybe it was okay, PG hoga, PG second year hoga. It got disconnected. No net. A little bit after it got connected, but I was sharing screen, so I did not know. So the default setting was mute.
Okay.
I was in middle of discussion, so slide share I was doing, so it directly opened to slide share. I taught them for around 30-40 minutes. That day I was not using this earphone one. I was only using this mic because that time they used to keep it mute everyone. So maybe students were saying, sir, we are not able to listen and all that because I was not using this one headphone. I did not know screen sharing. I thought almost all. Lastly, when I was about to take feedback, that time I came to know that it was mute because of this default connection.
Sir, in the same,
Go ahead.
in third semester, we had a whole psychology class without audio, sir.
Okay. So even now it would have happened because I did not see that. But as I was not sharing, no, it was seeing me as mute. Cross mark that. So this is how sometimes happens. So everything I told them half an hour, suddenly at the end I came to know that the students were saying actually, but I was not using this phone because they used to keep them mute. So this is how sometimes the entire effort will go wrong. Waste. So around 30 minutes class was gone wrong. Okay. So we have started with ADHD. So ADHD stands for attention, okay, deficit hyperactivity. So as we know,
sir, could you please repeat the abbreviation of this thing?
ADHD.
Attention deficit hyperactive disorder.
Yeah.
Okay, thank you,
ADHD, attention deficit hyperactivity disorder. Or if you simply type as ADHD also, it will show a whole lot of things. So getting information on net, yeah, go ahead. Ushasri, I've given. Okay. So getting information on net, very easy. You get much information. Okay. You will try to just look at them. So getting information, you should not bother. Already they have given material also. Material is also good. I have seen this. Okay. So no problem. Yeah. So this condition is characterized by hyperactivity. So the person is attention deficit. The person being hyperactive, so the things around him, okay, whichever is motivating, whichever is finding interest, so you try to get involved into that, and being very active. So if something is catching his attention, so he is leaving, or he will start losing interest in that particular thing what he is doing or continuing, and he will get on to the other one. So this is how, if we think that the person is multitasking, maybe no. Multitasking is, yes, you try to focus on, okay, simultaneously you try to do, but you don't leave them in between. You agree with this? Or incomplete. If you have taken a task, you try to complete it.
Yes, sir.
You agree with this?
Yes, sir.
You try to complete, then you move on to the other one. Okay, so you should not get confused between ADHD and multitasking. So if someone thinks that if a person is good at multitasking or doing certain things simultaneously, so you are mistaken. The person will live in between because he is easily losing interest because some other thing is catching his attention. So as other things are catching his attention rapidly, so once he losing interest, so he leaving that, is jumping onto the other task, and this is how, so he's not able to concentrate on one particular thing. So this is the characteristic of ADHD, attention deficit. Yeah, why is getting attention deficit? Is not sustaining, or his attention is not sustained for a longer time on one particular thing or a task, and it is not completely up to accomplishment or completion of the task also. Because if something other is catching his attention, so he's moving on to that and leaving the previous one without trying to complete that. So this is the characteristic of ADHD. Up here it's clear?
Yes, sir.
Yeah. So it is 5 to 12% in the population, that is boys and girls. So causes both environmental and biology, or when you're talking about biological, genetic, okay, role is also there. So this is with regard to ADHD. Then treatment would be of parental counseling. So why parental counseling is required?
To understand why this child is behaving a certain way and cater to his requirements.
Yeah. And make sure that as the person would be keeping on doing is jumping from one task to another task. So you make sure that the things, the left out one, okay, to be completed.
Yeah.
So he will initiating, is leaving that because it's no more interesting for him.
Yes.
Okay. And also not get frustrated with the particular behavior of the child because it is because of the disorder. Okay. Behavioral interventions, then pharmacotherapy through medicine. Okay. Pharmacotherapeutic, that is through certain design interventions, then educational measures. So these things will work better. Maybe yesterday, ma'am might have talked about certain therapeutic approaches also. Okay. So
Ma'am had discussed schizophrenia, sir.
Ma'am discussed
Schizophrenia.
Okay.
Unit 3, frauds, therapeutic techniques, dream analysis, countertransference,
Good.
psychoanalysis, humanistic therapeutic approaches.
Good. Okay. Therapeutic approaches also. Okay. So this is how, and also at this stage, you should remember one thing, that so you are expected to be aware of the terminology. As your friend asked, okay, what does it mean? What is the abbreviation? What are the characteristics? Is that okay?
Yes, sir.
So you are not asked about like treatment and etc. because you have this particular same paper at the PG level where you would be taught about, okay, in depth. Okay, so having knowledge about the disorders or the disordered conditions, characteristics, okay, is the focus of this particular paper. Okay, next, conduct disorder. What is conduct disorder? You take conduct certificate, no? Did you remember?
Yes, sir. Yes, sir.
Maybe now they are calling as bona fide hoga.
Yes, sir. Bona fide certificate.
They also used to call it as conduct and bona fide certificate, or if not, in bona fide they would have been written conduct is good.
Yes.
Good hoga, nahi to satisfactory, something they would have written, no?
Yes, sir.
But there would be mention of this particular word.
Yes, sir.
General statement is good, sir.
Okay, who was that? Who is talking?
Usha.
Usha, okay, Usha, right. That day she was with exams. Huh? Okay. So conduct. Okay, there they would have been written good. So what they're trying to tell?
We're trying to summarize a person's character within a couple of
Good.
words.
Good. So it is a common childhood psychiatric problem that has an increased incidence in adolescence. Okay. So as a conduct disorder, it will start, and if it is prevalent, it will continue and take the form of anti-social personality. Did you get me now?
Yes, sir.
In children, as a childhood, they call as conduct disorder. At the later stages, if it is continued, or it will take a form of as a antisocial personality disorders. Okay, now, if you know what is antisocial, then what all can be expected as a child? So that will become the characteristics of this particular conduct disorder. So antisocial is characterized by
having no boundaries, being disrespectful, trying to create chaos, playing pranks on others.
Pranks are appreciated, no?
But not necessarily.
In YouTube, they have channels, no? Followers, no? They're appreciating, no?
But that's not necessarily acceptable by society. Sometimes it crosses certain boundaries which are not acceptable, and also sometimes it can cause harm, unintentional harm to others. So destruction of public property, etc.
Excellent. Okay, destruction. Okay, or harming, physical harm as well as destruction of objects, etc. Don't want to follow rules or regulations. If someone says this is good, this is bad,
rebellious.
Don't want to follow that. Yes, being rebellious. Good, excellent. Okay. They get satisfaction or happy when they break rules or follow rules. What is it?
Yes, sir.
They feel happy when they follow or break rules.
When they break rules.
They don't want to be controlled by rules, regulations, etc. If someone says they don't want to follow that, okay, physically hurting or destruction of objects, properties, etc. They used to.
No regard for others' feelings or emotions.
Yes, lack of empathy. Antisocial level.
Yes.
Or when you talk about as a childhood, not bothered about others, least bothered. So this is the characteristic of conduct disorder. Okay, so this is how at the school level they're talking about conduct also. They say the particular person's conduct is either good or not good. Because what is adolescence age?
18.
Okay, so you need to be clear about that also. Lifespan, when did you have lifespan?
65, 70.
No. Lifespan paper, okay. Good. 50 is good. Lifespan she's talking about. 65 years she want to live. Okay, no. Lifespan development. Paper. You have this
14,
paper.
sir?
You studied already?
No, sir.
Okay, you are about to.
Okay.
Lifespan development. Okay. So there they talk about different stages. So early adolescence, late adolescence, like that. Okay. So by intermediate age or at the entrance of the 10th class, the person would be into early adolescence. So this is the reason. So in your school certificates, they're talking about contact. So that is with regard to age, because they are into childhood or late childhood, they call. Okay. So when it comes to causes, the causes for this particular conduct disorder is not known. Okay. Frustrating behavior of youngsters. Okay. Leading to blaming, etc. And symptoms are very, very common, and we know because people, they don't want to follow rules or regulations, etc. If, for example, like a small thing like a red light also, they don't want to follow that, they want to break. If someone blocks them, they try to harm them, etc. Okay, the treatment would be pharmacotherapy, that is through drugs, that is medicines, etc. And also CBT. Did ma'am talk about CBT? So cognitive behavior
Yes, sir.
therapy. Cognition in this sense, the way they think, they try to change it or restructure by making them aware. Okay. Then other interventional therapies will try to correct them. Okay. Then childhood depression. Okay. What is depression?
A mood
Feeling high or low?
feeling very low and
Okay.
moody.
Good. So did ma'am talk about mood disorders?
Yes, sir.
Yeah. Mood, when it is low, it is called as
Depression.
depression. When it is high,
Hyper.
happy state is called as mania.
Mania. Yeah, yes.
Yeah, you should not forget this. Okay.
Yes.
Hypomania, hypermania.
Yeah.
Okay. Unipolar, bipolar. So we are
Yes.
not getting to that because time we don't have.
Yes.
When you're talking about mood disorders, you should remember unipolar, bipolar. Okay. Under bipolar, you have the other ones. Dysthemic would be there. So it's all about mood disorders. So this particular topic, it is talking about childhood depression. Okay. So they have given on in terms of age also. Age 3 signs may include feeding problem, tantrums, common symptoms. So 3 to 5 include being accident prone, phobias, excessive self reapproach. Then 6 to 8 there may be vague physical complaints, aggressive behavior. 9 to 11 common symptoms would be excessive worrying. Can worrying lead to depression?
Yes, sir.
Okay, so don't worry much. If you're much worried about the future, what it is?
Pushes you into
Anxiety.
depression, anxiety. Yeah.
Yeah, anxiety, future oriented. Okay, so worrying. So you also should not worry. So this is with regard to age 9 to 11. So childhood depression. Okay, psychosomatic complaints, etc. So they also complain about the physical symptoms. Okay, body pains, aches, etc. Which again they call as psychosomatic disorders is other group of disorders. Maybe you don't have this one. It's better because the time they have given is also very less. Okay, if you are interested, please write on that and you check for that. Write on psychosomatic. Soma is body, so body related complaints. The person would be complaining about body related complaints or symptoms. It's only a psychological feeling. When they go for medical testing, etc., everything would be very, 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 very normal. Okay, so that is the condition of psychosomatic disorder. Okay.
Yes, sir.
So that is with regard to childhood depression. So whenever we're talking about depression, etc., so medication will be working more. So that is with regard to childhood depression. So endocrine gland, social factors.
Excuse me, sir. Sorry to interrupt. Could you please repeat the medication for the childhood depression?
Childhood depression, I don't know. They are only talking as pharmacotherapy they say. Okay, no, you write on, and you should also always remember that these things come under psychiatry. Okay, you know the difference between psychology and psychiatry, psychologists and psychiatrists?
Sir, could you kindly please elaborate in short words, if you don't mind?
Yeah, please remember. So a psychiatrist is a person who is having MBBS degree. Medical
Psychiatrist.
Yeah.
Yeah.
MBBS, then they go for MD psychiatry, MD, master's degree.
Okay, sir.
They are supposed to prescribe medicine because they have a medical degree.
Medical degree. Yes.
So when we're talking about psychologists, we have this psychology background, masters, bachelors of PG, PhD in psychology, and we are not supposed to prescribe medicine because we don't have the basic knowledge of this physiology or the body functioning. You agree with this?
Yes, sir. Yes.
So we are not permitted to give medication, etc. We can
So,
only conduct certain therapy like CBT they call, or
Okay.
ma'am might have talked about so many. So we would be only conducting therapies and not medicine based on the severity. So if things are not working with therapies, we need to definitely refer them to psychiatrist only. So based on the severity, so there is much limitation with regard to psychologists. Yes, go ahead.
so basically, a psychologist can become a counselor,
Yes, counselor, he can become.
but only thing is he cannot prescribe medication.
Yes. If you have a medical team also, mental health team, if not.
Yes.
So psychiatrist would be the head of that, followed by clinical psychologist.
Okay.
Then comes the psychologist.
Okay. So, for instance, someone who's suffering from serious disorder like bipolar. If someone is suffering from bipolar issue, so first he has to consult a psychiatrist, and he's prescribed medication by him. But over the period of time, if he's able to manage his symptoms and medication properly, can he continue with a psychologist as a counselor?
Yes, it can.
It can be.
Because when we're talking about mood disorders, as we
Okay.
know,
Yeah.
depression and mania.
Okay.
So being manic maybe does not bother much, but when we're talking about a person who is low depressive, they have suicidal tendencies, etc.
Okay.
So when the depression is very high,
Okay.
a severe acute depression, they say,
Okay.
so that time they may commit suicide. So they require medication. They have this insomnia, etc., which will not work or get controlled with this so-called therapy. So
Okay.
serious issues, they have to be dealt with psychiatrists
Psychiatrist.
with the help of medicine.
With the help of medicine, but
Yes, medication.
but they do
As a
require.
supportive,
Yeah.
as a supportive, and if they are not much dependent on the medicine, okay, to substitute that, so the person will continue with psychologist,
Okay.
and based on the severity, if it is coming low or within the control, the psychiatrist may leave it,
Okay.
and little bit extent the psychologist will support them, try to be with them, and after that they can also make the person independent.
So it depends on the progress they make with the treatment and counseling.
Yes, progress as well as based on the person. So how he is taking it.
Okay.
The family support,
Okay.
peer support. So supportive group is always very, very important. Mental health issue.
So it's a lifelong pattern. Lifelong, he has to balance his emotions and everything.
So whenever you try to get into normal, the things will be always good.
Okay. Okay,
So
sir.
when as we talk, when you're trying to get away,
Okay.
or when you don't apply rational, when you don't find the reasons behind them,
Okay.
so then only you try to deviate from them.
Yeah.
So that can be the problem. Okay. That's
Okay.
how you should always try to get back. So whenever something is happening as a normal people also, we will try to generally get back.
Okay.
So within this unit only, they have also given eating disorders. Eating disorders is again a new topic now. So look at this beauty of this syllabus.
So can I just ask, like Princess Diana also had this kind of eating disorder, right?
Yeah, not only Diana. So many famous personalities, they have this. Okay. So I will tell you. So eating disorder is not only about getting slim. which is also complete opposite. Okay. So what all you know about eating disorders?
Anorexia,
Dieting?
bulimia.
Okay.
It's not dieting, sir. It's just a fear of gaining weight. In some
Gaining weight. Good.
extreme
Or
cases,
just eating a lot.
in some cases,
Good.
extreme cases, what happens is the patient consumes food and just loves a couple of hours so that the nutrition is absorbed by the blood, and then they puke it intentionally so that they don't gain weight through calories. These cases are usually observed in models, mostly.
Good.
Because that's their sustenance.
More conscious about.
Very conscious.
Maintaining the figure, etc.
Yeah, because their career span is very limited. It's a span of 5 or 6 years, not more than that. So
good. So if they have
social
this
pressures
calculation,
also,
good.
so-called
They have
higher
this
societies, a certain expectations push these people to.
Good.
Yeah.
So if they have these calculations, anything wrong?
It's
If
obviously they're obviously damaging their throat and all that. No, so when you puking out all the food you've consumed, the acid also comes up and it causes injuries to your internal organs.
Someone's is disturbing here. Okay, so this is a condition where they are psychologically okay. They're getting into these particular thoughts that they are gaining weight. So when they themselves go and look into the mirror also, they are very thin. Skeletons also, psychologically, they are not convinced. So we're talking about models, etc. Okay, they're okay, looking, checking, etc. They're a little bit conscious. Everyone is conscious these days. Everyone have got smart watches. You agree with this?
Yes, sir.
Smart watches. Everyone is having a smart watch now. How much they're eating, how much they're walking, how much they're running, etc. Everything is there. But this is a severe condition. We always say disorder. Disorder is what, voluntary or involuntary?
Voluntary.
Can they control?
If they make an effort.
If they can control, if they can plan, can it be called as disorder?
No, sir.
No. So this is also with regard to eating, especially with regard to pattern of eating. Okay, the person.
Yeah.
Okay, is so much obsessed, maybe by eating. The person is eating in large quantity, not able to control. The other person is not able to eat because of the psychological feel of putting on weight. Okay, in between, some people, okay, not able to control the amount of intake what they're taking, okay, and also to immediately. So they are vomiting, self-induced vomiting they do. Because they need to take more and more food. And also the fear immediately that they're getting weight. Mixed feeling. So how difficult? Okay. So just we will look at the type. Okay. Anorexia nervosa. So it's an bolito without orexis bolito. It is a desire for. Okay. So without a desire for food, anorexia nervosa. So anorexia nervosa develops in early to late adolescence between the ages of 12 and 18.
So could you please repeat the definition of anorexia nervosa? I'll just note it down.
Without a desire for food. And and stands for without. Orexix. Oryx means a desire for. So anorexia means without a desire for food. Without a desire for food. Okay, so they don't have desire for food. Why they don't have? It is because psychologically they are in an impression that they are putting on more and more weight. Okay, that is anorexia nervosa, especially seen between the ages of 12 and 18 years. That is puberty to adolescence. So as it is also more prevalent in girl child. Okay, which says that maybe conscious with maintenance of body figure, etc., what they call in general. But these people, they being very, very sensitive, hypersensitive to these particular things with regard to the maintenance of the structure, etc. If you try to show them the pictures, even if they see in mirrors, but still they're not getting convinced. Okay, and they're not able to come out. Not able to come out. Please note down that. If trying to help them out, they also want to come out, but still they're not able to come out. So that is making this particular disorder. Okay, anorexia nervosa. The next, bulimia. Bulimia nervosa.
I think this is the one that Princess Diana had, right? Bulimia. This is the most talked about disorder.
Hoga. Okay, bulimia nervosa. Nervosa is getting nervous. Okay, bulimia. Okay, boys. Bulimia has been derived from Greek roots. Boys means ox or cow. Limos means hunger. Okay, it's clear now. Ox like hunger or cow like hunger. So generally what these ox do, ox or cows, what they do?
They eat. They're hungry.
All the time. You agree with that?
Yeah. Yes, sir.
Yeah, the same thing is seen in these people. If they're not eating, they're getting that. Okay? Nervous. Anxious. So, cow like hunger or eating pattern. So, one of the continuous eating like a cow chewing its cud. Okay, recurrent episodes of gorging in large quantity of food, followed by use of inappropriate ways to prevent weight gain. Look at them. Inappropriate ways to prevent weight gain. Okay, such like using the other chemical compounds or as simple as that of vomiting. Okay. The last one, binge eating. What is binge?
Eating non-stop.
Non-stop, more quantity.
More quantity and indulging by watching television or listening to music or it's basically an emotional eating, sir.
Overeating. Okay. Overall?
Yeah.
Overall?
Eating without whether you're hungry or no.
Yes. They're seeing something, that's it, they're eating.
Exactly, sir.
Not able to control. Yes, good. Lack of self-control. Yes, good. Or not able to resist. that urges of eating. Okay, so whenever they are seeing something, okay, they are eating. Okay, when you're talking about bulimia nervosa, they are also eating. Yes, we agree with that, but they are trying to vomit, etc., because of overweight, etc.
Yeah. They only allow the food to sit in their tummy for about a couple of hours till the nutrition is absorbed, and then they try to puke it out.
Okay, so treatment, psychoeducation, making them aware of that, making them self-monitoring, okay, nutritional counseling, okay, trying to explaining them, okay, what is nutrition value and how much they should take. For example, if people have no desire for eating, okay, making them aware so that they eat little bit, and also CBT they have given, okay, CBT also, and also as a family members, if we can make sure that at the time of eating, if all the family members are present on the table, so at least to some extent, we can make sure that everyone is eating, especially young girl child. So when you ask them to eat, no, they say they will eat afterwards. So what they do afterwards, they try to take very little amount, okay, maybe leading to undernutrition. Because at the time when everyone is present, so everyone would be looking at how much the quantity they are taking. You agree with this?
Yes, sir, absolutely.
So these people, they try to avoid gathering. And they say they're a little busy. They would take little bit afterwards because they know that when they are single, they can take little bit and manage. So these things, certain little experiences or the family habits also can be taken care. So you make sure that everyone is present at the dining table, or you make sure at least for a dinner or at least. If lunch is not possible, maybe dinner. So you all together so that you can watch their eating habits, etc. Then cyber disorders. Go ahead.
Like, so again, is this one of the traits of being antisocial?
No, antisocial.
Like the example that you have given just now about the table. So is this one of the traits of being antisocial again?
Antisocial was the did not fit.
No, so may I answer her?
Yes, yes, go ahead.
Yeah.
Go ahead.
So this is not anti-social per se, Anur. It's the social pressure of how a woman's body has to be. This is the added on pressure by the society. Women have to be a certain body type. They shouldn't put on weight. They have to be they have to dress a certain way. These are the social pressures we add on innocent, uneducated girls.
Yes.
It is not antisocial, but the other way around, actually. Societal pressures.
Antisocial is completely different.
Yeah.
Antisocial would be more among boys.
Yeah.
Certain things would be with regard to genders also. Okay.
Yeah.
Okay, thank you so much.
And also these days, this what they call zero size, no? It's very much common among girls, no?
That is the added pressure we put on innocent girls,
Yeah,
actually.
you yourself are putting on, no?
Yeah, yes.
No one is expecting them to be to follow that. Someone have started, everyone is following. They want to be like that only.
Yeah.
They are getting into an impression that if they are in that only, they would be accepted. You getting?
Yeah.
As a parents, they don't expect them to be like that. You agree with that?
Yes.
As a children, as a parents.
Our parents,
you don't expect them, right?
Yeah. Parents only want the kids to be happy, healthy.
Yes. But they are following certain trend we don't know.
Yeah.
So this is how they're getting in play. And they try to avoid. And the best way is to have a gathering, especially with regard to eating disorders.
Educating about body positivity.
Yes, yes, you can tell them. You can tell them what is that movement, why they have started, what benefit they have. And if it have nothing to do with you, just you can explain them, try to do that. Okay. Then cyber disorders, okay, cyber sexual addiction. Okay, you know that, pornography, etc. Cyber relationship. What is this relationship? Social media, simple terms.
Social media, yeah.
Okay, chattings, etc. There are many, so many. Okay, then internet addiction. Okay, how internet can be addiction? Actually, I don't want to take much time on these topics, but they are so
Wasting time
interesting.
on unnecessary stuff, sir.
Surfing on something, yes.
Surfing,
no, yes.
so yeah,
But why it is taking so much of time?
it's
Because it's
addictive.
having a lot of content that is attractive, though it's not of any use, but still people get interested in those kind of topics and it kind of waste their time.
Exactly.
You clicking something is opening. From there, you clicking something. It's taking you
It's just
getting
redirecting you to something that's only consuming your time.
you getting deeper into this. You're not able to come out. So that is making addiction. Initially, you started with searching what is, for example, hoga, bulimia. From there it started. Some heroine. As I said, someone's name. That from that, do you know this person? Okay, you will have a pop up. From there, it will take you to something. From
Curiosity.
there, it is taking you to something. So, internet addiction. You starting with something. Your intention is something. You thought of looking for something for few minutes, hoga, but you started
Not only
wandering
that, but
somewhere
due
and
to
not able to come
artificial
out.
intelligence also, what happens is like even if you're searching something an hour ago or a day ago, when you're searching something else, that link or that topic pops up and you're like, okay, I was thinking about this. And then you're, searching for that and clicking for that.
Again, getting back. Yes. Relevant searches. Relevant topics they would be. This is how internet, you spend some hours together. And at the end of the time, no, if you just look back, no, we don't find anything. Okay. Then computer addiction and cyberbullying. What is cyberbullying?
Talking
Harassment.
trash about people, harassing them,
People harassment.
yeah,
Okay?
leaking information.
Wrong idea. Fake profile IDs,
Fake IDs.
etc. They try to create nuisance. Yes, mocking.
Yeah.
Okay, they do all that. Okay, some people they get fun, hoga. But we should also make people aware that there is rule regulations also which will take their action. Yes, you agree with this?
Yes, so actions have consequences.
Yes, consequences.
Yeah.
So making ourselves aware and also the known people about the consequences will help them to come out of this particular computer, especially internet related addictions. Okay. Then what's the next topic?
Intellectual disability, mental retardation.
Intellectual disabilities, nothing but mental
retardation.
Okay, you should always remember that. Previously, they used to call it as mental retardation. Okay, but they have replaced that with more comprehensive term, which is called as intellectual disability. Because this particular classification or this particular disorder is because of the intellectual scores. It depends on our intellectual abilities. People low on this intelligence or intellectual abilities are into this particular disordered condition. So that is the reason they're calling as intellectual disabilities. So previously they used to call
mental retardation.
Okay, so don't get confused. In exam, sometimes they ask you about direct what are intellectual disabilities. So you should not get confused because the term is been replaced by intellectual disabilities, which is actually the correct one. Okay, and also I hope on first day I asked about like what would be our IQ levels, right? As
Yes,
normal
sir.
people, how much
Yes.
IQ level we have?
Yes, sir.
Did you check that? Got an idea about that?
Yeah. Yes.
So as a normal people, how much you have? I even talked about a bell shape curve, etc.
Yes, sir.
So As a normal person, how much IQ you have?
85 to 114 between average intelligence.
Mm-hmm.
Above
Usha?
average is
Okay. Let me check with Usha. So how much we have? Noor, how much we have? Any idea? Yes, no.
No, sir. Actually, I didn't attend that class. I wasn't aware
Good.
that we were having. So I'm just, learning.
Good. Other people not learning. Hmm?
No, not learning. No, learning is not the actual word. I'm just trying to collect what all information I'm getting today.
Actually, the other day we have discussed on this IQ. The people who have
Who
like
is this? Who is this?
Usha.
Because
Usha, sir. That's Usha.
Usha, I'm expecting single word. Yes, no. What is the range? Because you dragging single fill in the blank to the essay type answers. Okay. Yeah, it's open to you. How much?
we fall in the normal range.
Oh, very intellectual answer. Normal range, I'm asking. So if you see on the screen, can you see the screen? Is screen visible to you?
Yes, sir.
Is it visible to you now?
It's visible,
Okay.
sir.
Yeah. So it's starting from 70. Is it going upward or downward? Downward. Okay. And 90 to 110 is the normal. So what is missing here? 70 to 80, 80 to 90. Average people having 90 to 110. So if people having IQs from 70 and below, mental retarded,
Yes.
intellectually low. So some people are missing in between. You agree with this now? You getting me? What I'm trying to tell you?
Yes, sir.
Who all should fit into that?
Below 70%, sir.
Okay, we will think about that. So who will come in between 70 to 80, 80 to 90?
90.
Hmm?
Yes.
Okay, so if the IQ level is from 70 to 50, mild mental retardation. Okay, what is mild? Severity is very, very less. So these people, they are very much normal. With little bit of mental retardation. Okay, so when it is, that is below 50 to 35. Okay, moderate level. From 35 below to up to 20, severe. 20 and less, it's called profound. So mental retardation based on the IQ levels, it is classified into 4 divisions. Okay, mild, moderate, severe, and profound. Okay, mild being the slightest one. Okay, so these mild people are very much normal. They can continue or they continue as a normal people. They have no issues at all. Sometimes they get into this retarded behavior. Okay, even moderate. Okay, we can teach them. You can employ them. They can do their things without any effort. Okay, when it comes to severe, okay, so these people, they require support. They cannot live their life individually. Okay, and also they find it difficult to to do their basic activity. So what all can be basic activities? Basic living or self-care activities. Okay. So they may not be able to do. So we need to teach them so they can do certain little basic under supervision. So when we're talking about the last level, profound, so completely a supervisor or a support is required for them. So they cannot perform or they cannot do the even the basic one. So you should be with them, you should tell them to do, then only they can. Okay. So up to moderate level, we can teach them skills, certain skills, and we can also employ. So they can earn their bread and butter. So teachable. But when it comes to severe and profound, so they cannot learn because their IQ levels are so less, okay, and they require a continuous support or supervision. So without a supervision, they cannot live their normal life. Okay. So if you go to NIMH, previously it used to be called as National Institute of Mental Handicap. Okay, so there we can find up to moderate level. They are learned, skilled, they would be employed and they would be doing work also. Maybe the other groups not employable because they cannot learn skills. So, and also the person should be with them to assist them to carry on the general basic needs also they need to be supported. Okay, so this is with regard to mental retardation. Yeah. Anything you would like to add?
No, sir.
Was it clear?
Yes, sir.
Sir,
also,
could you just
when it
please
comes-
abbreviate NINA once?
Now the name has been changed. Write down
Pardon, sir?
NIMH.
NI?
NMH. National Institute for Mentally Handicapped. It was previously, it used to be called. Now they have completely changed the name. Okay, you search with the old name, you will find it. As
Okay,
we're talking about the intellectual disability, the name also been replaced by the National Institute for Intellectually Disabled. Right? Okay, you check it first. You search with the old name. Okay, then we talked about so 70 above to 90. Slow learners, have you heard about slow learners?
Yes, sir. Asperger's syndrome can come
Slow
under
learners.
that. But also, they can also be very intelligent also, no, sir?
IQ levels. Okay,
IQ
they
levels,
fall
yeah.
based on that, they follow that. And also learning disabilities. So learning disabilities, have you heard about learning disabilities? Tare Zamin Par?
Yes, sir. Dyslexia.
Dyslexia, good. Okay, learning disability. Okay,
Yeah.
such people will fit into this. The other one, above 70, that is 80 to 110. So learning disabled, slow learners, so they will come into this particular gap between the average and between the mentally or intellectually disabled people. Okay. The last 12th topic is about addictions again. Actually, what is an addiction?
A habit which you cannot get rid of.
Why a person is not able to get rid of?
For example, a person who smokes cannot get rid of smoking, and an alcoholic cannot stop drinking because they're addicted to substances. These are substance addictions.
Good.
Mm,
Why, if people can come out of these habits of drinking tea, coffee, etc., why these people are not able to come out? Or even tea, coffee people also, they are saying we're getting headache when they don't take
yes, sir.
tea at the correct time.
It's, I guess, the way you tune your mind into thinking that without it you cannot start working, or without it you cannot progress.
Okay,
Or
you have any this type of
caffeine
dependency?
addict.
Okay, Usha, you?
No, sir.
Why Usha is low this day? I don't know. Saina?
Mic is not supporting, sir.
Not supporting. Okay. If not, it would have been non-stop. Good. Sainath, who is the Sainath? You want to talk? Anything?
No, sir.
Clear gunda? Ardhamavutunda? At least?
Ardhamavutund. Yes.
Carry చేయొచ్చు కదా? Get on.
Yes, sir. Yes.
Good. So, they may say, you saying that if you don't take coffee, tea, no, you're getting headache. So if we don't take this particular thing, no, we are getting headache. So anything wrong?
It's about knowing what, for example, if you're smoking continuously, you're harming your lungs intentionally. But when you can skip having too much of excess of coffee and all that, that's rational thinking.
Excess of coffee, no effect, no harm.
As long as you limit it for 1 or 2 cups, I don't think it's causing any harm. But if you're having more than 5-6 cups of coffee a day, you're basically on adrenaline and you're always hyper.
Gives you kind of a refreshment or active, such kind of a feeling.
Yes.
Okay? So after drinking a cup of coffee or tea, the person is saying, I'm getting, or I feel refreshed.
Yeah.
Okay. So the same thing will happen with regard to other chemical compounds. Okay. Maybe it is alcohol or a chemical compound. Okay. What they call commercialized drugs. Okay. When we're talking about drugs, medicine is different. The banned substances, chemical substances, that is different. Okay. As we're talking about, okay, even coffee, nicotine, or caffeine, they are getting, or they're giving you a sense of stimulation. They give a sense of stimulation, refreshment, as if you're getting some energy, energized. So in the same way, these chemical compounds also making you get into some altered states of mind. And if the person started liking them, okay, they are also continuing that. Okay. And so this is how the body is getting dependent. Okay. So once the person start using that, okay, then the so-called, the word comes tolerance. Okay, so chemical compounds. So as they started taking, so maybe that the initial content what they used to take is no more giving that particular kind of a feel. So to get that feel, what they will be doing generally?
They either latch on to another new kind of addiction.
Okay, with regard to same quantity?
No, not necessarily. For example, if a person is addicted to opioids like oxy pills or something, which is milder compared to heroin or coke. So it really depends. If it's basically a person jumping from a pan to a boxer.
So generally, with regard to addiction, okay, body will get adjust to that particular dosage.
Yeah.
It's no more giving that particular kick, what they call in general, or that stimulation. So this is how, because it's getting tolerance, so the person will start increasing the quantity to get that particular feel. Okay, so this is how you are the person will start with initial, and this is how they keeping on increasing to get that particular effect. Because at one point of time, the body, okay, is no more responding to that particular quantity. So to make it to get excited, the quantity has to be reduced. So tolerance. So tolerance is abuse. You started using much more. Then what happens if the people is not giving that particular required compound or use dependent compound? Will there be side effects?
Yes, sir. It's called withdrawal.
Good. Withdrawal symptoms. This.
Yeah.
So whenever there is a withdrawal, okay, body will start showing withdrawal symptoms. Okay. So this particular example I would like to give. So at the beginning of this corona pandemic, when there was lockdown, so what about this? Okay, alcoholism. The people
There were a
used to
lot of
take.
smugglings going on, though it was a lockdown. The consumption hasn't stopped anywhere.
Good.
The
People,
number of,
especially with regard to people,
yeah.
did they experience any abnormal behaviors?
Yes, sir. All the mental institutions were flowing with all the were flowing with all the patients because they were acting out because of a withdrawal and
That symptom, that reaction by the body is called as withdrawal symptom.
yeah.
So as the body used to get stimulated for that particular required component, so it is getting dependent on that. Okay, when that particular substance is not given, so it is showing certain symptoms which are called as withdrawal symptoms. So this is the reason the substance, because they're giving some effect, the person start loving it, pleasure seeking. Okay, so they are getting into this, not able to come out of that, and also once it's get used, the body is also giving certain signals which are called as abnormal, okay, symptom. Okay, so this is the reason as a layman, so suddenly we cannot stop. So when they come to de-addiction centers, so they would be brought in a systematic manner out of this particular dependence. So behavioral modification techniques they call. Okay, so they try to, okay, in a systematic and a planned manner, they try to bring them back to normalcy because there would be withdrawal symptoms. Okay, so this is with regard to substance and substance abuse. Okay, so intoxication, so taking, okay, compounds, and also drug abuse or chemical compounds when they start liking them, using more than the prescribed. So why they are using more than the prescribed?
Because they're
Because
oblivious to all kinds of
yeah, they're
problems.
loving that. They're loving that effect.
Yeah.
They're loving the compound. Yes, so this is what is called as, okay, substance induced or substance related addiction. Okay, as a layman, as a normal people, suddenly you cannot stop. So someone is smoking, you cannot suddenly make them stop. Someone is taking alcohol, you cannot. Okay, as a normal people, they do cry and ask them not to take anything. Don't touch from this moment. So it will not work because immediately withdrawal symptoms will follow. So it has to be brought down in a very systematic manner. If not, there would be lapse and relapse. The person will get back again to the habit. Okay, that is start taking them. Okay, another one is aversion therapy. It's also the thing which give them pain so that they forget or they don't get that particular thoughts of taking these particular compounds. And also chewables, like for example nicotine, cigars, etc. Okay, they ask them to take this particular chewing gums, etc., which also give a minute feel of that particular chemical compound. Okay, so as a substitute, they try to give them. Over a period of time, they ask the person to come out, and all about the person should have strong willpower, the strong supporting. What happens if once they start saying that I am trying to come out or I want to come out, will the other people allow them?
If it has a good support system, they will help the person to get rid of that addiction.
Generally, what happens?
People just try to mock them, like, what, you won't be able to do that. There's no encouragement that, yeah, you can do it.
Even some people, they offer them.
That's true when it comes to cigarettes. Yes.
Because this particular habits, no, it is a social grouping, etc. So they have a good peer group. Okay? Someone or the other would be daily contributing, the things would be keeping on continuing. So they don't want to break the chain. So they try to retain the person by offering it. Previously, they would have not offered any party kind of a thing, but now when the person have decided, they try to make the person continue by offering. Okay? Yes. Time up. Thumbs up. Okay? I got a message. Okay? It's a time to wind off. Okay? I hope we try to cover, and especially with regard to Unit 8, it talks about, okay, amnesia, forgetting, etc. Okay, you try to look at that. Is that 8th unit? Okay, which one is the unit?
8th one, sir. Dementia, Parkinson's disease.
Dementia, Parkinson, Alzheimer's.
Yes.
Okay, Parkinson, etc. These are about forgetting. Okay, progressive. Over a period of time, the person will start forgetting.
Yeah.
He will forget, okay, minute things from larger to even about his personal name. The time. So when these people, they start getting identified or diagnosed with this Alzheimer's, okay, they arrange a party, they tell everyone thank you, goodbye. Famous personalities, they do that because over a period of time, they even forgetting everyone. They don't remember anything. It's called as, okay, neurodegenerative. The nerve cells are dying or they are losing the ability to remember. So this is how over a period of time, they forget everything. Okay. So delirium, dementia, all these things, brain
So
trauma.
sorry to interrupt. Could you please repeat the
Okay.
term neuro?
So this is with regard to forgetting because of neuro or neural cells, nerve cells getting damaged progressively over a period of time. They start, okay, losing the memories. So this is with regard to cognitive impairment disorders. They would be very easy. You try to go through that. We don't have time, and it's time to say goodbye. Okay, take care.
Thank you
All the
very
best.
much, sir. Thank you for all the help. Thank you.
Okay, see you all tomorrow. Sorry.
Maybe
So,
in the next semester, sir.
hopefully, we don't know that.
Yeah.
If Bravo invites, definitely. Okay,
Yeah.
take care. All the best.
Thank you very much, sir.
Being student of psychology,
Thank
you
you,
should
sir.
always be able to have these things in mind. Have a positive outlook for the people who have these particular disorders. Try to help them or at least guide them to the professionals. Okay?
Sure, sir.
All the best.
Thank you, sir.